Hello, my name is Whitney Buzzard. I am a senior BSN student at the University of St. Francis in Fort Wayne, Indiana. This is a presentation about certified nurse midwives. Today I will look at the history of nurse midwives, a job description and qualifications, salary and demand, positive and negative aspects about the career, and a look at the future of certified nurse midwifery. All through history, women have been attending births. Before 1750 in colonial America, women attended most births. This was due to the fact that men were not allowed to attend births because it was considered indecent. Also, there were few doctors. In 1765, the first formal training for midwives was opened. By the early 1800s, there was a shift to using doctors versus midwives due to the advent of more medical schools and the ideology that women served in only the domestic role. In 1873, 3 training schools for nurses opened in New York. This would set the stage for nurses as midwives. By the early 1900s, transportation became more evolved and hospitals became more accessible. There was also still a prejudice against women and their intellectual abilities. However, midwives were still used by women who couldn't afford physicians. In 1920, Mary Breckinridge founded the Frontier Nurse Service. She was the first to bring nurse midwifery to the United States. By 1939, 50 to 75% of all urban women were delivering in hospitals, and by 1950, that number rose to 80%. By 1950, there were 7 nurse midwife programs running in the United States. In 1955, the American College of Nurse Midwives was formed, becoming the voice for nurse midwives, and Columbia Presbyterian Sloan Hospital in New York City was the first hospital to open up to nurse midwives. By 1960, 97% of births were occurring in hospitals, and by 1970, national certification in nurse midwife educational programs was set in place. Certified nurse midwives are now used in a number of settings. 2006 saw the single biggest one-year increase of births attended by certified nurse midwives since 1998. In 2006, certified nurse midwives attended 7.4% of all U.S. births. This number continues to grow. It is estimated that there are now over 7,000 certified nurse midwives practicing in the United States. The Certified Nurse Midwife, or CNM, provides care for childbearing women during preconception, prenatal, labor and delivery, and postpartum. The CNM can also provide family planning counseling. A CNM provides an alternative to traditional childbirth by an OB/GYN for patients considered low risk. Any patient with high risk is referred to a physician. The CNM provides holistic care to both mom and baby, and this care is considered more natural than traditional childbirth. The CNM can serve as the primary gynecological provider for women. A CNM can work in many settings. Most work in hospitals or private practices. The American College of Nurse Midwives holds the position that certified nurse midwives must be graduate-prepared nurses. This means that certified nurse midwives must have a minimum of a Master's of Science in Nursing, or MSN. Many certified nurse midwife programs offer an MSN degree with certified nurse midwife certification. A survey done by the American College of Nurse Midwives in 2007 showed that the median salary for all midwives is between $79,000 and $89,000 a year. This survey also showed that there was a direct correlation between salary and the degree held and years of experience. A midwife that is not a certified nurse midwife would not earn as much as a midwife with a graduate degree. As healthcare continues to change and patients become consumers, certified nurse midwives provide an attractive option to expectant mothers. Certified nurse midwives can provide more cost-effective care, and many work closely with physicians, making the practice very safe. All of these factors are leading to the increasing demand for certified nurse midwives. There are both positive and negative aspects about being a certified nurse midwife. Some positive aspects are that birth by certified nurse midwife provides a more natural and alternative option to traditional childbirth. Also, certified nurse midwives follow the mother through all stages of pregnancy and provide more patient-centered care. There are many options for patient teaching for the certified nurse midwife, and therefore certified nurse midwives can make a huge impact in a woman's life. Another positive aspect is that because certified nurse midwives are not physicians, they can provide more cost-effective care to patients. In a tight economy, this leads to an increase in demand and a good salary. Also, being a certified nurse midwife can provide more flexibility in hours other than other forms of nursing, and certified nurse midwives work independently for the most part under a physician. Some negative aspects about being a certified nurse midwife include long hours and an irregular schedule. Because childbirth is unpredictable, the certified nurse midwife could be called on a moment's notice. Also, there can be a general lack of respect in the medical field for certified nurse midwives. While this is better than it has been in history, certified nurse midwives still work to earn respect in their field. Because a certified nurse midwife can only care for low-risk patients, this limits the number of patients a certified nurse midwife can see. This could be seen as a negative aspect. Lastly, like other professions, things don't always go according to plan, and grief can occur with poor outcomes. The future of nurse midwifery is unknown. However, if current trends continue, the number of practicing certified nurse midwives will continue to grow as well. Recent shifts in society and the economy are leading to new demands on healthcare. These factors are leading to the increasing demand for certified nurse midwives. Certified nurse midwives and all advanced practice nurses may soon play a larger role in healthcare.